Bismillah ar-Rahman ar-Rahim. In this lecture, I want to talk about pancreatic pseudocysts. Pancreatic pseudocysts are a circumscribed collection of fluid rich in pancreatic enzymes, blood, and non-necrotic tissue, typically located in the lesser sac of the abdomen. We are seeing here CT scan showing large pancreatic pseudocyst in the lesser sac. But we are seeing here pseudocyst, localized collections of pancreatic secretions and necrotic cells. Virtually all arise after a bout of acute or chronic pancreatitis, lack a true epithelial lining. But the pancreatic pseudocyst is lined by macrophages and fibrosis. Pancreatic pseudocysts are usually complications of pancreatitis, chronic or acute, chronic pancreatitis or acute pancreatitis. Although in children, pancreatic pseudocysts frequently occur following abdominal trauma. This is pancreatic pseudocyst post-abdominal trauma. Pancreatic pseudocysts account for approximately 75% of all pancreatic masses. Pancreatic pseudocysts are surrounded by a wall of fibrous tissue that is not lined by epithelium. Pancreatic pseudocysts are connected with the pancreatic duct system, either as a direct communication or indirectly via the pancreatic parenchyma. We are seeing here pancreatic pseudocyst connected with the main pancreatic duct. Pancreatic pseudocysts are a common clinical problem and complicate the course of chronic pancreatitis in 30 to 40% of patients. Causes of pancreatic pseudocysts: pancreatitis, chronic pancreatitis or acute pancreatitis, pancreatic neoplasm, pancreatic trauma or pancreatic injury. Symptoms and signs of pancreatic pseudocysts: abdominal pain, fever, bloating, nausea, and vomiting. The abdominal pain more than 3 weeks, between 80 to 90% of cases. Signs of pancreatic pseudocysts: tenderness, abdominal fullness. Lack of appetite, swollen belly or swollen in the abdomen, and abdominal mass detected on physical examination. The symptoms of pancreatic pseudocysts can occur within days to months after an attack of pancreatitis and include bloating of the abdomen, constant pain or deep ache in the abdomen, which may also be felt in the bag, difficulty eating and digesting food. Complications of pancreatic pseudocysts: cystic infection, cystic hemorrhage, cystic rupture. Bleeding into the spleen or a blood clot in a spleen vein, portal hypertension, gastric outlet obstruction, portal or splenic vein thrombosis, and perhaps causes portal hypertension, erosion of the gastroduodenal and splenic artery or vein, and causes bleeding into the spleen, obstruction in stomach, duodenum, colon, ureter. Pathophysiology of pancreatic pseudocysts. Pancreatic pseudocysts are sometimes called false cysts because they don't have an epithelial lining. The wall of the pseudocyst is vascular and fibrotic, encapsulated in the area around the pancreas. This is pancreas and this is the pancreatic pseudocyst. Pancreatic pseudocysts take up to 6 weeks to completely form. Pathophysiology of pancreatic pseudocysts. Acute pancreatitis results, amongst other things, in the disruption of pancreatic parenchyma and the ductal system. This results in extravasations of pancreatic enzymes, which in turn digest the adjoining tissues. This results in a collection of a fluid containing pancreatic enzymes, hemolyzed blood, and necrotic debris around the pancreas. Around this is the pancreas and this is the pancreatic pseudocyst. The lesser sac being a potential space, the fluid collects here preferentially. Now, diagnosis of pancreatic pseudocysts. Your health care provider will ask about your health history, symptoms, and other health conditions. He or she will also give you an examination focusing on your abdomen. To diagnose pancreatitis, your healthcare provider may do tests. These may include blood tests, high levels of pancreatic enzymes, for example, amylase, CBC, levels of electrolyte, sodium, potassium, and the levels of glucose in the blood. Imaging tests for diagnosis of pancreatic pseudocysts: ultrasound of the abdomen. We are seeing here ultrasound of the abdomen, pseudocyst, and this is pancreas. CT scan of the abdomen. This is the gold standard for initial assessment and follow-up. This is the pancreatic pseudocyst. MRCP to establish the relationship of the pseudocyst to the pancreatic ducts and common bile duct, though not routinely used. This is the pseudocyst with MRCP. Now, treatment of pancreatic pseudocysts. Pancreatic pseudocyst treatment should be aimed to avoiding any complication. 1 in 10 cases become infected. They also tend to rupture and have shown that large cysts have a higher likelihood to become more symptomatic, even needing surgery. If no signs of infection are present, initial treatment may include conservative measures such as bowel rest NPO, parenteral nutrition TPN, and observation. If symptoms do not improve, then endoscopic drainage may be necessary. The majority of pseudocysts can be treated endoscopically. Surgical intervention is rarely necessary. In the event of surgery, cystogastrostomy. In this surgical procedure, a connection is created between the back wall of the stomach and the cyst, such that the cyst drains into the stomach. Cystojejunostomy. In this procedure, a connection is created between the cyst and small intestine, so that the cyst fluid directly into the small intestine. Cystoduodenostomy. In this procedure, a connection is created between the duodenum and the cyst to allow drainage of the cyst content into the duodenum. The type of surgical procedure depends on the location of the cyst. For pseudocysts that occur in the head of the pancreas, a cystoduodenostomy is usually performed. In the end of this lecture, thank you for all.